Ballot Initiative 65 would establish a medical marijuana program in Mississippi for patients suffering from debilitating medical conditions. The diagnosis would come from a licensed physician, and then the patient would be certified to obtain medical marijuana from a licensed and regulated treatment center. At the state capitol, a full-throated denouncement of Initiative 65 by some members of the legislature and some state officials. State Health Officer Dr. Thomas Dobbs says implementing the 65 program under his agency would pull them away from dealing with coronavirus.
This is the largest pandemic in over a century. We're about to embark on the biggest immunization effort ever in the world. And then we're going to be distracted by this nonsense.
I think that it is shameful that legislators would stand at the state capitol who have blocked every single attempt for medical marijuana. They've blocked more than 20 proposed bills over the last decade for medical marijuana for patients who are suffering here who need it.
Dr. Dobbs, on a Facebook Live taking questions from Mississippians about 65, says he believes the initiative leaves a lot of questions unanswered.
There wouldn't be any sort of strict control over the type of marijuana that's used, the percent THC. Is it going to be a gummy bear? Is it going to be a cookie? Is it going to be a blunt? Or is it going to be something else?
Initiative 65 would set up a conservative, tightly regulated medical marijuana program for patients with debilitating and often incurable diseases like multiple sclerosis, cancer, PTSD.
Jamie Grantham says nearly 250,000 Mississippians got this measure on the ballot because they need it. If 65 passes, Mississippi would join 34 other states across the country that have medical marijuana programs, including nearby states like Arkansas, Louisiana, and Florida.
16 WAPT's Troy Johnson joining us live. And Troy, those opposed to 65 have been saying the measure changes the state constitution.
Yeah, Keegan, that's true. They argue that it will change the state constitution permanently. What they're not saying is that both 65 and 65A would amend the state constitution. 65A also establishes a medical marijuana program, but has no start date and no guarantee that one would ever get started. A lot for voters to think about leading up to Tuesday. Keegan?